Hi, I'm Stacy Coulter, and I'm here with my colleague Erin Jenewein, and we're here today to talk about a topic that's very interesting to us, which is diagnosing pediatric ocular disease in kids. We both work at Nova Southeastern University in the pediatric service. We do a lot of pediatric primary care, and one of the challenges with kids is that pediatric ocular disease is not common. So that when a child has it, you have to really think through how is it presenting and what are some of the diagnostic tests that I can or can't do on this kid. How do I present the information that I know or to the testing or the referral that I want to do to parents. So we want to explore that a little bit in our talk at the Academy. And I'm going to let Erin Jenewein share some of her background and things as well, and then we'll talk a little bit about some of the content area. But Erin, can you just talk a little bit about PEDS and ocular diagnosis and your practice?
Sure. I also work in the Pediatrics and Binocular Vision Service here at Nova, and I find that a few things are difficult about diagnosing and treating pediatric disease. First of all, one complication that I have are sometimes the parents aren't necessarily the people that come with the child, so getting a proper history can often be very difficult. And I think we explore that a little bit on some of the cases I'm presenting, because if you don't have a proper systemic or even family history, it may be very difficult to diagnose a condition in a child. Additionally, some things that we see in children and pediatric disease are caused by systemic conditions, so it's really very important that we diagnose them properly so these children can be treated.
Okay. So as Erin said, we're primary eye care providers, but sometimes when we diagnose rare disease in kids, it's not just the eyes that are involved, it's other systemic conditions as well. For myself, because I've been practicing pediatric optometry for about 20 years, I'm really interested in the newer technologies that are coming out, like OCT and some of the digital technology. There's been a lot of information about how those work in adults. And many young children and even sometimes toddlers and preschoolers are testable. The challenge in using those types of tests in kids is not always getting the child to do them. It's how do we interpret that information, those findings. We don't always have norms for pediatric patients. What's the appropriate use of technologies, as well as traditional technologies like visual field and fluorescein angiography and other types of tests that we do. So I'm really interested in sort of looking at newer information that's just evolving now, and specifically, how does it apply to that pediatric kid, who I have in the chair? What can I do today? What should I refer? And how confident am I of the differential diagnosis and diagnosis that I have? And Erin?
Another thing we have to think about in children is treating them can often be difficult because some of the treatments we use for adults may not be appropriate for children because they're growing. And also we have to worry about both their vision and health for a longer period of time than an adult. So I'm also very interested in explore topics about treating disease and look in ocular side effects such as glaucoma, cataracts, and amblyopia in children, and how to avoid those things as best we can when we're treating disease in children, which can often be very difficult.
And I just also want to just make one closing comment on what Erin was saying, and that is, yes, we do have to think about function. We often interface with schools, with teachers, with other people outside the families, and particularly when a child does have reduced vision, we need to make sure that all the players who work with that kids know how that impacts their function. So we have a very special role with kids, and we look forward to exploring that a little bit in our talk at the Academy.